and welcome to Zambia Today. I'm your host, Faith Katai. It's that time of the year again when our communities and homes become prone to cholera. Cholera is a diarrheal disease caused by eating contaminated foods and drinks. It affects the intestines, causing severe diarrhea and vomiting. Symptoms include frequent watery stool and vomiting rice water-like fluid. A person with cholera can die from dehydration within hours if not treated by a medical professional or taken to the nearest health clinic or hospital. Joining me in the studio is Dr. Doreen Shempela, Director of Public Health Policy, Diplomacy and Communication at the Zambia National Public Health Institute, ZNPHI. She's here to share more about cholera and how it can be prevented. Doc, welcome to the program.
Thank you so much.
Yes, so just give us an update on the cholera situation across the country.
Thank you so much. As of Saturday, the 17th of January, our cumulative total stood at 655 cases from the time the outbreak was declared on the 5th of August last year. In the last 24 hours, we recorded 11 new cases, and we also recorded 16 cases in admission, and all these were within Lusaka district. And as ZNPHI, working closely with our cooperating partners under the leadership of the ministry, we are eagerly following the pandemic, and we want to assure you that as ZNPHI, it's our mandate to ensure that our communities are safe and protected, and we are doing everything we can to ensure that the outbreak is contained.
Great. Maybe we can talk about the first signs of contracting cholera. What are the first signs that one should look out for?
The most critical sign is profuse watery diarrhea, and the diarrhea from a cholera patient is very different. We call it rice water-like. So it's very easy for you to tell just by the way the diarrhea appears. So there's profuse diarrhea that starts, and this is usually followed by vomiting. And that is why you see that dehydration happens quite quickly in a cholera patient. And you have to look for signs of dehydration. In most cases, a patient has sunken eyes, and they are weak, and they have muscle cramps as well, and this results from the fact that the patient has lost a lot of fluids and a lot of salts. So there's muscle weakness, there's dehydration, and there's watery diarrhea and vomiting. So once you see all these symptoms, I think the most important thing that the community should do is quick referral to the health facility, because if you delay referring the patient to the health facility, you find that dehydration will occur quite quickly, and in most cases what kills is dehydration.
Great. So let's talk about how this disease, or how does it spread?
Cholera is a waterborne disease, and you get it through eating contaminated food. You get cholera through drinking contaminated water, and also poor hygiene practices, things like not washing our hands after using the washrooms. So if some of these things, if as the community, if we are going to take care of our own hygiene, we wash our hands after using the toilet with soap and clean water. We ensure that we don't take undercooked food. We ensure that the fruits that we buy from the markets, we wash them thoroughly with clean water. We ensure that the water that we are taking is boiled or chlorinated. We'll be able to contain the spread. In most cases, these are the main drivers of cholera: eating contaminated food, drinking contaminated water, and poor hygiene practices that I've explained.
Okay. So which places like now in the country are mostly affected?
When we declared the outbreak in August last year, it was mainly in northern province, particularly Mpulungu, and we have over 500 cases coming from that province. We had pockets of outbreaks in southern province. I think that has been brought under control. We had a few pockets in central province, Copper Belt as well. The last week we are trying to contain the outbreaks that have happened in Lusaka. Nothing to worry about. These are just small numbers, but we are trying to ensure that the outbreak is not spread, because you know that Lusaka, we have high dense areas, so much so that if we allow the outbreak to go out of control, it's going to be a big problem. So we are trying by all means to ensure that the outbreak in Lusaka is contained, and from Pulungo as well, we are working very closely. Our teams are on the ground ensuring that everything is brought under control.
Okay, so what are some of the myths that we have as Zambians about cholera in our communities?
There are a lot of myths, and such myths are very dangerous because somehow they do prevent some of these messages from really reaching the community out there. There's a myth that cholera is something that comes from witchcraft. People believe that when you have cholera, you have been bewitched. There's a myth that cholera is something that happens to those that are dirty. So a person like you, some people believe that they can't get cholera. But you see, cholera is a bacterial disease. Anyone can get cholera. If you're going to have untreated water, you get cholera. There's also another myth, by the way, that once you've gotten cholera once, you're not likely to get it again. But you can be vaccinated, you can get cholera, and you'll still be able to get cholera if you drink contaminated water, if you eat contaminated food, if you don't practice hygiene. So all those are myths that we should be able to dispel, I think, as ZNPHI, when we come on forums like this, so that our communities are given the correct information on how to protect themselves. So the correct thing is cholera is a bacterial disease. It's not caused by witchcraft. It's not something that can only be, that can affect dirty people. It can affect everyone, including you and me, if we don't take precautions.
Great. Yeah. We now pause for a short break. Stay tuned.
What is cholera?
Cholera is a diarrheal disease. A person with cholera will have severe diarrhea and vomiting. The stool will be watery, like rice water. The patient will become dehydrated due to loss of body fluids. The patient may die within 12 hours if he or she does not get proper medical treatment.
How can one get cholera?
Drinking untreated or contaminated water. Eating foods with contaminated, dirty hands, or using utensils washed with untreated water. Eating uncovered foods that has been exposed to flies. Eating cold or leftover foods that have not been properly stored. Eating food sold on the streets. Eating fruits and vegetables that have not been washed.
How can we prevent cholera?
Treat your drinking water by boiling or using chlorine. Do not eat foods from the streets. Wash your hands with soap and treated water after using the toilet. Heat food before eating it. Cover all food to keep away flies. Use the toilet always. Avoid using containers or plastic bags for the disposal of fecal matter. Make sure all feces are disposed of in the toilet. Keep the toilet clean and covered.
This message is brought to you by the Ministry of Health in conjunction with the Zambia National Public Health Institute.
Welcome back. This is Zambia. Today we are discussing cholera and how it can be prevented. And to explain in detail, I have with me ZNPHI, Director of Public Health, Policy, Diplomacy and Communication, Dr. Doreen Shempela. Doc, what preventive measures should individuals and communities take to avoid cholera outbreaks and further spread, especially in our communities, in schools?
Okay. I'll start with the measures that we can do at individual level. The good news with cholera prevention is that most of these things are within our control. They are things that we can do ourselves. So at individual level, what is very important is to ensure that your water is safe. Boiling your water. If you have chlorine, chlorinating your water. As ZNPHI, working with the ministry, in every community, like in Lusaka, in all the 7 sub-districts, we have put what we are calling oral rehydration points. And these points are manned by our community-based volunteers under the supervision of our health workers. So these community-based volunteers are able to train you how to make your own oral rehydration salt at home, but also they have ORIs which they can be able to give. For example, in the community, if there's a cholera case, as you are waiting to transition the patient to the next cholera treatment center, you can take the patient at the oral hydration point source, or you can get some ORS from there and give the patient so that you keep them rehydrated as you transition. So for individuals, what is important, as I've said, is to ensure that your water is clean. At individual level also, what is important is that the food that we take is also clean. Our hands are also clean. Because the food can be clean, but if your hands are contaminated, it means, for example, if you are a person that is selling food and your hands are contaminated, you find that as people buy that food, because your hands are contaminated and they don't wash fruits, for example, thoroughly, that becomes a mode in which you can be able to get cholera. So as individuals, let's make sure that our hands are thoroughly washed with water which is clean, and also soap, so that we are handling food with clean hands. Sanitation also, let's avoid in the communities, for example, let's avoid open defecation. You know, there are a lot of floods now. So if the community members are doing open defecation, and now with the floods, you know what happens. That serves as a breeding ground for cholera. So in the communities, for example, if there's a case of cholera, it's very important that as community, because the community response is our first defense, it's very important that we quickly identify the cases, we quickly notify our local health centers, so that immediately our rapid response teams come in and help to decontaminate and do what we are calling case area target intervention. So, for example, if it's happening in one locality, we are going to ensure that we have a radius of about 150 households. We make sure that we distribute chlorine in that community. We make sure that we also give not only liquid chlorine to decontaminate your water, but also granular chlorine that we use to decontaminate our pit latrines. We also make sure that we give health education, because in most cases, the myths that we are talking about out there, people feel I can't get cholera because it's meant for a certain group of people. So in the community, let's cooperate with our teams that are already on the ground right now in all the hotspots and all the affected areas, and make sure that we work together as a community. We clean, make sure that our waste disposal is done in an appropriate way, make sure that we use pit latrines, and as I've said, we avoid open defecation, so that we manage to contain cholera, because this is a collective action. So the individuals have a role. The community also have a role. And our community-based volunteers that are also in this community, they are going door by door, just making sure that they give health education and health promotion messages, so that our communities are also empowered with information on how to prevent cholera and how to handle a case if it was to arise in the community.
Awesome. So as ZNPHI, are you able to give us an update on the awareness programs that you have put in place to deal with this cholera?
Yes, we are using a multi-pronged approach. Programs like what I'm doing right now. So we are giving information on television. We are also giving information on radio, and we are using local languages on radio. So most of the community radios, we are giving these messages on how do the communities prevent themselves from getting cholera. So we are using radio, we are using television. We've also produced IEC information, IEC materials, posters, leaflets, brochures, and all these have also been translated in major languages, so that language is not a barrier. Another approach that we are using to provide this information are the foot soldiers that we are using, the community-based volunteers. So these are the ones who are foot soldiers in the community, visiting households, families, discussing with families. And also we are working with schools, because we know that a school is another platform that we can use to disseminate information, health promotion. So we are working very close with a number of sectors so that this information is given to the community timely and accurately, so that there are no misinformation and there are no information that is not accurate. So we are using a number of platforms to ensure that the communities get empowered with the right information. And also we are doing a lot of risk engagement and a lot of community engagement using churches as well, schools, as I've said, community members and civic leaders. So it's a comprehensive approach that we are using.
Awesome.
Yeah.
So how have people responded to the cholera vaccine? And those who received the cholera vaccine, how has it helped?
Okay. Before I respond on how people have responded to the vaccine, I wanted just to state that vaccinations are a complementary tool that the ZNPHI is using. And we are very happy that the response to vaccination has been overwhelming. There's no vaccine hesitancy. Most of our community members are very happy, and the uptake is good. And research has also proved that when you get the vaccination, it improves your immunity, and you find that once you've gotten the vaccination, even if you get cholera, the severity is different from one who hasn't gotten the vaccine. Yes, the vaccine is not a magic bullet. We have to ensure that once you've been vaccinated, you also combine it with also other hygiene practices that I've explained. But generally, the vaccination has been good. In Northern Province, the targeted area, we vaccinated 100%. It shows that the vaccine has been accepted. We also did vaccination when we had some hotspots in Southern Province. We also went in quickly and did vaccination, and we also achieved 100% coverage in there. For Lusaka, where we have started receiving a few cases in Lusaka sub-district, we are also trying to go, I think we'll be doing the vaccinations this week. We are just training our community-based volunteers so that they start, first of all, you need to create awareness so that community members know that vaccines have been rolled out in Lusaka district. So this is something that we are working on, because we've seen that vaccines have been accepted by the community, and also vaccines are very, very effective. And they've seen that the number of cases that we've seen controlled is as a result of the vaccination that has been a success.
Wonderful. So this vaccination, where is it taking place? Is it any hospital or any health facility?
We've identified, we know the way we do our vaccinations, it's targeted. Because you can't vaccinate everyone. The vaccines usually are not enough. So we look at the hotspots. Like for Lusaka, as I've said, you've seen that Nali sub-district, we are receiving a number of cases from Chainda, and these are the places that we are going to prioritize, because if we can concentrate on the hotspots and contain there, we'll be able to contain. Because if we're just going to give everyone, we may end up, we give based on risk. So we do a risk assessment, and we know that, okay, if we're going to target this area, we're going to manage to give enough vaccines, and all the people that are at risk, all the people that are targeted, remember it's targeted vaccination, are going to ensure that we've given them the vaccine, and we'll be able to ensure the coverage that we are targeting. So it's going to be on a risk-based, looking at the risk in that particular area, targeted vaccination, and we'll be able to move in that because the vaccines are never enough to go around to even those that are not at risk. We are going to concentrate on the hotspots for now.
Great. So what long-term strategies are needed to sustainably reduce the risk of cholera outbreaks in our communities?
Thank you so much. As much as at the moment we are working on containing the current outbreak, as the government through the Ministry of Health and also other line ministries, we are working on long-term strategies, because we want to come to a place where Zambia, cholera is a thing of the past. And there's a lot of support from the ministry. Actually, there's a lot of support all the way from the president. We want to eliminate cholera in Zambia. And multi-sectoral discussions have been going on. We are working not only the Ministry of Health alone, but we are also working with the ministries that are responsible for water. We are working with the ministries that are responsible for local government, because cholera is not a Ministry of Health thing. It's supposed to be handled in a multi-sectoral manner. So you find that the ministry that is responsible for water and sanitation, we are all working together. How do we improve the sanitation and the wash infrastructure? Because once that is improved, then our communities are going to have safe water. Our communities are going to have safe sanitation facilities. For example, if we're going to talk about waste management, our local Ministry of Local Government, how are we going to ensure that the waste that is generated is also disposed of correctly, promptly, so that that waste doesn't pose to be a health challenge to our community members, and that is handled by another ministry. Education as well, health information, the Ministry of Education, the number of children that are in schools. We are working together. How do we ensure that we give information to the school-going children? How do we ensure that we use pupils as agents of change? Issues of sanitation, schools are very, very critical because, you know, in most cases, when you go and give information to the pupils, information goes very far because they'll go home and they'll tell their parents, they'll tell their guardians, they'll tell their friends what we learned at school, that we need to wash hands. So we are doing all these things. But also in terms of long-term investment, laboratory infrastructure is something that the ministry is working on. And we've already seen that this happening in provinces like Northern Province. We want to ensure that laboratory services, you know, detection, quick confirmation is very, very critical. We don't have to wait for samples to come to, for example, ZNPHI. We need to make sure that the facilities are able to detect quickly, they're able to confirm. So all those are things that we are working on, and we've seen that a lot has happened, and you'll be able to see that, for example, in Northern Province, we've strengthened the diagnostic part where it started last year in August, so that they don't have to send samples all the way, but they should be able to get the suspected cases quickly, take them to the lab, quickly do the testing, confirm, and they act, and we move into response. So all those are things that we are working together to ensure that we have got sustainable long-term solutions.
Awesome. So, Doc, as we come to the end of the program, what would be your closing remarks?
Okay. My closing remarks, Faith, cholera is preventable, and cholera is treatable. We don't have to panic. We just have to work together. We just have to work collectively together, and we'll be able to contain. It's not something that should, I know there's a lot of panic, especially with the Lusaka sub-district, a few cases that we've reported, but the Ministry of Health, working with ZNPHI and its partners, are working 24/7. The priority that the ministry has is the safety of the community. And we are working, we have the interest of the community's safety at heart. So we don't have to panic. Cholera, as I've said, is preventable. It's also treatable. Let's just seek early treatment. Let's just make sure that we take care of ourselves, and let's make sure that our water is safe, our food is safe, our water is clean, and as I've said, let's seek medical attention promptly, and we should be able to contain the outbreak.
Dr. Shempela, thank you so much for making an appearance on Zambia Today.
Thank you so much. It's a pleasure.
Viewers, there you have it. Let's do our part to keep our community safe. Remember, clean water, clean hands, and safe food are key to preventing cholera. If you suspect cholera, seek medical help immediately at the nearest health facility. On behalf of the entire Zanis production team, my name is Faith Katai. Goodbye. Keep watching Zanis TV.